Well, I keep telling people that life is very kind. So firstly, all of you have survived a disaster in the planet. So may I say cheers to that, to everyone?
Cheers.
Without coffee, not our donuts. We have this lovely lady over here who made up a slight change, because I was there and talking to her, and it was the kindness in her. I asked, she had 2 donuts. She had 2 donuts. It is so sweet. I went to her and asked her, can I take one? She said, thought for a moment and said yes. And I was touched. Really, I was touched. She was not only being kind to me, she was actually being kind to herself too. She said, you will take away the calories which otherwise I would have consumed. Sometimes that is all that you need, not pills, but just a voice to tell you that, can we change your life a little bit? And would you like it? And the person thinks again and says, yes, it's the right thing to do and I am going to do it. And that's how she did it. She thought about it, that it was good for me and for her if that donut left her plate. I took that donut, I did not want to eat it. I just did not feel that it would be good for her to eat, and her sentiment was no different. I took it, I put it out there, and I was telling her that sometimes I do this for my wife too, or for my son, who I think is not eating the right thing. I eat it, but I do something with it. So what do I do? And why do I do what I do? I will just explain to you. I love sports. I love playing badminton. I love playing tennis. I love playing ping pong. I somewhat enjoy going bicycling because it's too lonely, so it's not my ideal activity. Whenever I do something like that, I make sure that I have a reason to go and enjoy that social life. I go and play. So small changes, small activities in our lives can give us a message. In our practice, we believe that prescription writing is the easiest thing that can be done, but the easiest thing is probably the worst thing that can be done. Because if you do go to a doctor, it is an opportunity to motivate you, to change the way you live so that your life will be better. The real meaning of the word doctor is not a healer. The real meaning of the word doctor actually is a teacher. So when you come to our practice, our goal is that as you leave, you already feel better about you and your future, simply because we're going to teach you small things. We have multiple doctors in our practice. We all have the same philosophy. Some of us talk one way, other people talk another way. Just because you meet me does not mean you have not met the others. They are very similar. They have a very similar work philosophy that is not about writing prescriptions. It's not about filling out paperwork, although the government has mandates on filling out paperwork that we cannot escape, and we have to do that. And we sometimes even give somebody much less qualified than us to fill out that paperwork with you, help you out, even though you have to fill it out and it's a pain because the print is small sometimes, etc., etc. I would love for you to come and take a flavor of our practice. We have a gym in our practice that is exclusive to our patients. We have a personal trainer who works there, so we don't just give you a real estate space and machines. We have a motivated person who actually is a trained physical therapist from Venezuela, but when he came here, the language barrier held him back from going further, and he was working in a nursing home. He came to me, I think what attracted me the most about him was that he cared about his son so much. He was willing to do anything because he wanted to be able to send his son to college. And that's who he is. He's a caring man. And many times we are born in a man's body, but we have the sentiment of the caring of a lady. And I know that there are not many of us around, but we are around. And that's what I try and tell our staff and doctors, physicians as well, when we sit and chat. And we don't just chat about this philosophy. Whenever we meet, which is typically once a week, we teach each other. One of us takes on the role of taking on a topic and teaching the others about medicine. Because as we age and further away we get from our educational years, we will start to forget stuff or not even learn stuff that is new, changed, and better. That, goals for blood pressure are different, goals for diabetes are different, goals for weight loss are different, the methods of achieving control in all these is different, how to approach arthritis, what type of exercise to do, how can you treat somebody's depression, how can you treat somebody's back pain without medicines, how can you treat somebody's depression without medicine. So all these things, there is new technology out there and never existed when I got out of medical school. Even though I got out of medical school as the best graduate of my medical school, I still find myself deficient and find the need to learn. And that need to learn is quenched in our practice by educating each other. And as we deliver lectures to others, trust me, we become way better. Because as you teach, you're forced to teach, you're forced to read much more than what you will speak. So our quality of work continues to improve and further improve for the benefit of the practice, of course, benefit of the patient. If you like the philosophy that we work with and would like to take a taste of what we do, get in a group, get into your own car if you want to, but make a change. Make a change. I was sitting here today, as I entered this, I found that this room was dark. I had come from the outside, and outside it is so beautiful. It's a little warm, which is what we came to Florida for. It's a little warm. But that light will elevate your mood. I would like you to enjoy that. Not sit in a dark building and, in a little apartment somewhere by yourselves. I was asking others if there are any group activities here. And the answer came out, there are, but not many people participate. So what I would like you all to do is that you might be the guys who are leaders. You might be the people who can lead others to a better life and in return feel better about yourself too. Our practice is not far from here. It is on Mariner. Do you know where Springstead High School is? Yes? Right next to it is an obnoxiously yellow building. That's where we practice. Behind our practice is a light blue building where my wife practices. So if women have a problem, we try and, like a female type problem, we have help that can be much more acceptable to many women. That a woman will be there to examine you for those things, like breast exam, etc., can be done with her. She also does primary care, and we all together continue to enhance the quality as well as the spirit of our practice. I hope to see many of you come at least to take a flavor of what we have. Okay? I'm open to any questions if you have any. We do take Ultimate Healthcare. We do take other plans as well. When you come, we will tell you about those as well. But I have to thank the people from Ultimate to have me here. And they have excellent plans. And many a time the physician doesn't make money with some kinds of plans because they're structured in such a way that they're terrible. With them, the patient also has a lot of savings, and we also earn a fair amount. So it is not that the physician is unhappy to take that plan. The physicians are happy to take Ultimate. Okay.
Thank you, doctor.
Thank you. Any questions? Do you guys dance?
You take United.
My United Medicare?
Yes.
Medicare United?
Yes.
Yes. My wife's practice does, But my wife's practice has the same spirit and the same facilities available to whosoever in her practice. Yeah.
But he's able to go to the gym?
Yes.
Yes. Okay, that's...
If you would like to come and enjoy the gym and the trainer, yes, even through her practice, you will have the same facilities.
Okay.
Yes. We have special machines that will exercise your back to the extent where I have tried it myself and my back pain left me. We have the #1 effective weight loss program in the county. There was a contest countywide. Our team lost the most weight. The next team that lost weight, there was a difference of about 20% weight loss. So that's the second runners up or at that point. So we do have a wonderful way of taking care of things. We like to find ways to save money for the patient. Because sometimes the copays of medicines can be very high. And we see, how can we change this? How can we, because people run into what's called the donut hole sometimes, and then they will have to have out-of-pocket expenses. And when your income is not unlimited and you're not working, suddenly you hit a wall and you start to worry. Because the worst medicine is the medicine that you cannot afford. Because you know you need it and you can't have it.
And another thing to touch on with that, with the medication costs, with Ultimate Health Plans, we do have, that chronic condition plan, the one for individuals who take things for, the heart, or maybe things for anything diabetic related, lung disorders, people with COPD. All those types of things, those really expensive medications, Eliquis, Xarelto, all of the insulins, all of these medications, a large variety of them are covered under that plan. And what that allows you is when people fall into that donut hole, when you go to the pharmacy and they're like, oh, it'll be a $220 copay for a 30-day supply. I mean, who can afford that? It's crazy. So our plan, the way it's structured, we will continue to cover that medication even for those individuals in the donut hole. So you pay your $10 copay, you get that month's supply of that medication, and that lasts all year long. So you stay on that copay the entire time. And then, also all your other medications, because even your generic medications, your tier 2 medications, it varies for everybody, but when you hit that donut hole, it's not just the expensive medication that you have to pay that 25% for, it's all of your medications. So we cover all of your generics, and we cover all of those expensive tier 5 medications through that coverage gap. So you won't pay anything for your generics, and you'll only pay the $10 copay for the more expensive ones. Yeah. And that might not apply to anybody here in the room, it might. But if anybody has a question about any of those medications, anything you might be curious about, obviously we're still here, feel free to ask us. But you guys might also know somebody else in the building. I mean, we've been here maybe 3 times over the last 2 months or so, and I think I've met 5 different people that have been on a medication in our tier 5. So I know there's people here that could use the help with it and just don't know that it's there. So it's another big thing to think about. If you guys might know anybody, also let them know as well.
Yeah, in healthcare, the problem is that you don't know what could help you pay for it. Resources are there, but somebody like him who is qualified, who could be a great resource for you to say, okay, the cost can go down. Because health is not just physical health or emotional health, but there's spiritual health, there's financial health, there's sexual health, there's educational and knowledge health. So there are so many different types and aspects of health that it's so important to say, okay, where's my resource? A great financial resource is right there. Guys, thank you very much for having me, listening to me, tolerating me, interrupting your coffee.